about before we get into the meat of the COVID situation at the moment. Can we just have a quick word about the situation in Southampton? I mean, what is your understanding as to what's gone on?
Well, I've spoken to the Defence Secretary, the Home Secretary, and of course this is a live police investigation, so there's a limit to what I can say. But I can confirm that the crew are safe and that the operation to secure the vessel has concluded successfully. And really, I'd like to pay tribute to the police and the armed forces who did such an exemplary job. As you say, this is what they train for, and this is what they're there for, to protect our country. And they did that to such a high standard that we come to expect.
Can we turn our attention then to free school meals? Has the government, I mean, is there an acknowledgement that you've totally misjudged the mood of the nation when it comes to this issue?
Well, what I'd say is that we've put in a huge amount of extra investment to support people during this coronavirus pandemic. And we've put in an extra £20 a week into universal credit. And we've also put money directly into supporting people in these circumstances. I think what I'd say is that I agree very strongly with the purpose of the campaign run by Marcus Rashford. I think we're all inspired by the way that he's led that campaign. And the purpose is that no child should go hungry, and that's right. The question is how we then fulfil that. And so I think that there is there's a need during this pandemic and at all times for the country to come together and to support people. And that's what we're doing, putting that investment in.
Yeah, but over the weekend, as you'll be very well aware, we've seen businesses, charities, councils, including Conservative-run councils, all stepping up to the plate and saying they're going to provide these free meals despite of the official government position. That goes to show, doesn't it, that actually more direct action is needed?
I think that it's absolutely wonderful, the companies that have come forward and are playing their part and supporting people in these very difficult times. I also think that it's brilliant that the councils are coming forward, having been funded by central government. £63 million has gone to councils so that they can do exactly what you say, so that they can support people and make sure that everybody and every child gets the support that they need. In my own local council, I looked up the figures. They were granted £750,000 by the government in order to support children who are in need. Extra money that's gone in. And now councils across the country, as you say, along with businesses and lots of individuals, are coming forward with this sort of support. The support from the councils, of course, I welcome it, because that is the councils delivering with the funding that has been provided by central government. And I saw yesterday that Marcus Rashford called for people to work together and for collaboration on this. And I strongly agree with that. It's about making sure that we give everybody the best possible start in life in what are very difficult circumstances.
Well, in terms of coming together then, shouldn't the Prime Minister meet Marcus Rashford and get a proper first-hand chat with him about what it is like to be a child in poverty?
Well, I know that they've been communicating, and in fact I'm here and going to be talking about a different food issue, which is hospital food, the need to improve hospital food, working with Prue Leith and the Prime Minister on that. So, yes, of course, we work on a huge array of issues which are about improving people's lives. Improving hospital food is one of them, very, very important subject, and I'm confident that we can make sure hospital food contributes to your recovery, and then also, on making sure that all children get good food in this country. we can deliver that. We should be able to deliver that, and we must deliver it. Hence the money that the government's put in, working with councils, working with the businesses who've stepped up. So I think this needs to be a big team effort, everybody coming together across party lines to make sure that children get the support that they need.
But within all of that, there is still the problem that people, it sounds great in a way when you say, well, we're providing the money, we're just providing it in a different way. The Children's Commissioner, Anne Longfield, told Sky News yesterday she's horrified by the debate. The Royal College of Paediatrics and Child Health are very unhappy about it. Obviously, the Welsh and Scottish governments, the Northern Ireland Executive, are all stepping in a way that the Westminster government isn't. Isn't it time that, that whatever you've put forward in terms of finances in other ways, you just need to react to what the people in this country seem to want?
Well, look, I also want no child to go hungry, of course. And the putting in money to deliver that through councils who often know better, are close to their local community and can therefore make the decisions to make sure that the people who really need it get the support. I think that's the way to do this, and we have put in that extra...
Forgive me for interrupting, but if that's the case, then why didn't you do that during the summer? I mean, obviously, during the summer, you relented, you decided to put on free school meals. If it applied then, why does it not apply now, moving forward into next year?
Well, of course, the situation was different in the summer and in the spring, and that was because schools were out for months and months, and people were often being educated at home. There was because of the pandemic. From September, school's been back. The vast majority of children are back in school. Of course, occasionally they have to isolate, but the vast majority are back in school. And so I think, obviously when they're in school, then children get free school meals if they need them. And we can go to the system that I think will deliver best, which is making sure that the councils can support children with the money provided by central government, working together to try to ensure that everybody gets the support they need. It's a question of how we deliver on that, and I think with the £63 million that's been put in, that's gone to each local council, that is a good way to deliver on this noble ambition.
The Labour Party wants to bring this back before the Commons for a second vote. If that happens, will you vote against this again?
I'll vote to support delivering for the needs of children in the best way that we think is the most effective. That's why I supported obviously the government motion last week. And we can have votes on it. I think the debate is it's perfectly reasonable to have the debate about how we do this. What nobody should be under any question about is whether we want to support all children to get a good food and a good meal at all times. And of course we do, in the same way that I, as Health Secretary, want to make sure that everybody in hospital gets good food and that all patients can have food that helps contribute to their recovery. That's what I came on to talk about today, but I'm quite happy to answer the questions about the free school meals issue, because I think it's important that to get the explanation across that we are putting this money in. It's a question of how it's best delivered, and I think that councils have got a really important role in that.
Can we talk about test and trace? Because it was reported over the weekend that you're considering people who are contacted via test and trace, saying they've been in contact with someone who has tested positive, that their isolation time will be reduced from 14 days to 7 because you are struggling with compliance. Is that led in any way by the science?
Well, this is entirely led by the clinical science. This question, it's always under review. You might remember that a couple of months ago we increased the amount of time that people who have a positive test have to isolate from 7 days to 10 days. That's a clinical decision. In fact, I was in contact with my French opposite number over the weekend because there they have reduced the amount of time people have to isolate based on their clinical advice. So it isn't about the compliance issue, it's about the overall clinical judgment of what time is required for isolation. Obviously, I'd rather have isolation as short as is reasonably possible because of the impact it has on people's lives, but it must be safe. And that, precisely as you say, is a clinical judgment, and so we'll be listening very strongly to what the clinicians say and be guided by the science, as we have been in all decisions in this pandemic.
But in terms of keeping a handle on this pandemic, which clearly is not working very well at the moment, test and trace is not working properly. 60% of the people who tested positive being successfully contacted and told to quarantine on test and trace last week. That's the lowest figures ever. We're told it has to be 80% for it to be effective. What is going wrong with test and trace? Why is it not delivering? And is it time to get new leadership in there?
Well, no, just on a point of detail in your question, the way you said it is wrong. 80% of people who test positive we managed to get in contact with. This test and trace system is incredibly important. And if you think about it, we've built one of the biggest organisations in the country in a few short months, and that has been a huge challenge. And I pay tribute to everybody from Dido Harding and throughout the leadership team and everybody involved on the ground in delivering that service. And what it delivers is now over 1/3 tests a day. There were 340,000 yesterday. A capacity on track to get to 500,000 by the end of the year. And now over 1 million people have been asked to isolate by NHS Test and Trace. And that's important because that's over 1 million people who could have inadvertently passed on the virus, who instead were asked to isolate. Now, that is an extraordinary scale of operation. And it's been built in a record amount of time, and it's been an absolutely huge challenge, and it continues to grow. What we need also to do is get the growth in cases under control. The increase in cases has slowed, but it's still going up, and so we need to keep following the rules. All of us have got a role to play. And we've got to keep under review what the rules are in each individual area to try to make sure that we bring that curve and get it going down rather than going up as it is at the moment.
So just a final thought then, because this is continuing to go up, whose fault is that? Is it down to the way the messaging? Are we having a lack of clear messaging? Is it the confusion over the tier system? Is it just that people aren't doing what they're meant to do?
Well, I think if you look right across Europe, we're seeing a rise in the number of cases. In Spain, overnight, they've brought in a curfew, and they have moved to the sort of tiers system that we introduced here a couple of weeks ago. In Italy, the number of cases is rising, and in France, and in fact in Germany. So right across Europe, we're seeing this second wave. The question is what we can do to stop it becoming more hospitalisations and more deaths, which sadly we've also been seeing. And the answer to that, for every single person watching, is that by following the rules and by respecting social distancing, hands, face, space, the basics, and then, of course, in the areas of higher prevalence, following the rules for that level, not meeting people outside your household, that is what we can all best do to keep this virus under control and to help this country come through it. It's about collaboration. It's about people working together, putting politics to one side and doing everything we can, and each of us has a role to play.